welcome to Bladder Cancer, Knowing the Risks and Warning Signs, our Patient Insight webinar programs. We'd like to thank CVS Health for making this program possible during Bladder Cancer Awareness Month. And I'm joined today by Dr. Lambros Stamatakis. He's the Director of Urologic Oncology at MedStar Washington Hospital Center and an Assistant Professor in Urology at the Georgetown University School of Medicine.
Let's just get started. This is a brief overview of what I hope to cover today. I will talk a bit about the epidemiology of bladder cancer and then focus our discussion on symptoms and other warning signs that are associated with bladder cancer, and also review the risk factors for developing bladder cancer with a particular emphasis on smoking. And as Stephanie said before, we can then have some time for questions, and my hope is to be done by 6 p.m. So this figure depicts the estimated incidence of new cases of cancer in the United States in 2018. And it's broken down into the organ of origin and between males and females. So as you can see at the top of the screen here, there will be approximately 62,000 new cases of bladder cancer in men diagnosed this year. That makes it the fourth most common malignancy in males in the United States. The bottom section of this figure shows the estimated number of deaths due to cancer in 2018. And as shown, about 12,500 patients will die of bladder cancer this year, making it the 8th most common cause of cancer death in males in the United States. So as shown in the previous figure, bladder cancer is more common in men than in women. While the reason behind this discrepancy in incidence is unclear, what we do know is that women with bladder cancer do tend to present with the more advanced stages of the disease than their male counterparts. And this is something that we're going to dive into with a little bit more detail later on in the presentation. But suffice it to say that this is a disease that is more common in men than in women. Geographically, there's a wide variation in the incidence of bladder cancer, with Western Europe and North America having the highest incidence, while countries in Eastern Europe and Asia having the lowest incidence. And even within the United States, there are significant regional differences in bladder cancer incidence, with the highest being in the Northeast and the lowest incidence in states like Utah and Hawaii. These differences do seem to hold when controlled for other factors like smoking rates amongst different parts of the country, which may suggest that there is some sort of environmental factor that is unaccounted for in these high-risk areas. So how about race? In the United States, white males have the highest risk, with roughly twice the incidence seen in African Americans and Hispanic males. But despite the increased incidence in Caucasians, African American patients do have worse survival rates, as shown in the next graph we'll see in a second, that will depict 5-year survival rates based on bladder cancer stage. So let's get to that graph, which I think is next. So as seen here, the green bars depict survival rates of Caucasians, and the blue bars depict survival rates amongst African Americans. And as you can see, that for all stages of bladder cancer, African Americans fare worse in terms of bladder cancer survival compared to Caucasians. And the differences may be due to different biologic or genetic factors. It could be due to occupational differences, or perhaps variations in access to cancer care. So it is something that is a major area of research interest that's ongoing. Let's move on to some of the risk factors that are associated with the development of bladder cancer, with the focus on chemical exposures, particularly smoking. So we're also going to talk about occupational chemical exposures, chemicals that potentially could be found in our drinking water, and other miscellaneous chemicals. So the idea is that these chemicals sort of enter our body and ultimately get dumped into our urine and interact with the urothelium, which again is the lining of the bladder, as well as the urethra and the upper urinary tract. And this interaction between these chemicals presumably leads to genetic changes that can lead to the development of malignant tumors. Okay, so let's start with smoking. So cigarette smoking is the most important factor contributing to the overall incidence of bladder cancer in Western countries, with an estimate that over 50% of bladder cancer cases are due to smoking. While the specific carcinogen or carcinogens in cigarette smoke that lead to the development of bladder cancer aren't completely known, there are over 60 to 70 unique carcinogens that have been characterized in cigarette smoke. There is some emerging data that suggests that even vaping could be associated with cancer development. Just before this presentation, I just looked up any sort of new studies that have been associating vaping with bladder cancer, and I didn't find any substantive data that would suggest that there is a direct association between vaping and bladder cancer, but certainly there's a lot of variability about what people could potentially be inhaling with these electronic cigarettes, et cetera. So there's a lot to still be discovered about this. Interestingly, just to play devil's advocate, there are a lot of publications about the potential benefits of using electronic cigarettes in smoking cessation programs. So really the jury's still out on this issue, but I do think it's something that we as a bladder cancer community need to be very aware of as we counsel patients about this. So the relationship between smoking and the risk of bladder cancer is very well illustrated by a prospective study that was published in the Journal of the American Medical Association in 2011. And this is known as the National Institutes of Health and the AARP Diet and Health Study Cohort. And this study followed approximately 465,000 individuals from 1995 to 2006. And the goal of this study was really to improve the understanding of the relationship between diet as well as other lifestyle factors like smoking and ultimate health outcomes. So what the study found was that current smokers have an approximately 4 times a higher risk of developing bladder cancer than individuals who've never smoked. And while the risk decreases in patients who were former smokers, their relative risk never normalizes to the level seen in people who have never smoked and will remain elevated throughout their lifetime. Also from this study, they looked at people who had smoked things other than cigarettes like pipes and cigars. And while it looks like those individuals had a slightly lower risk of developing bladder cancer compared to cigarette smokers, their risk overall was still higher than than people that have never smoked before. The extent of smoking also appears to be related to the aggressiveness of bladder cancer. In another study of approximately 740 patients, heavy smokers, which is defined as those who smoked an average of a pack per day for 30 years or more, were much more likely to have a high-grade tumor or muscle invasive disease at original presentation compared with non-smokers. Secondhand smoke is also a risk factor for developing bladder cancer. In a study from Los Angeles County, which included 148 patients with bladder cancer, as well as 292 patients without bladder cancer that served as controls, all of whom were non-smokers, showed a couple of interesting findings. So one is that women who lived with 2 or more smokers during childhood had an approximately 3-fold increased risk of developing bladder cancer compared with those without any sort of childhood exposure to secondhand smoke. In addition, women with a domestic partner who smoked for 10 or more years had a 2-fold increased incidence compared with those without such an exposure. Now, this is interesting because the study did not identify similar associations in males who had never smoked, and it may be due to some limitations of the study or perhaps some biologic differences between men and women. But the bottom line is that secondhand smoke exposure does also seem to increase your risk of developing subsequent bladder cancer. So while smoking cessation does not completely eliminate the heightened risk of developing bladder cancer, it certainly helps. So in patients who have already had bladder cancer, quitting smoking does appear to decrease the rate of tumor recurrence in patients with non-muscle invasive bladder cancer, and may also have some beneficial cancer-specific effects in those with more advanced bladder cancer. So the bottom line and a major take-home point from this presentation is that smoking cessation is likely the only easy modifiable factor that can reduce one's risk of bladder cancer. And it's something that we really, as providers, as well as patient advocates, should be focusing on. And to kind of put all of this together, Beacon has created this really fantastic handout that includes a lot of the information that I spoke about in the previous slides, as well as some other resources. And there are also some additional great resources that our patient advocates at Beacon can provide interested parties with, from groups like the National Cancer Institute that can help you or your loved ones quit. So for example, a website that I should have put on this presentation is www.smokefree.gov, and that's through the National Cancer Institute, and it has a plethora of information on how to get started with smoking cessation. And it's also something that you should talk to your primary care providers about, as well as your cancer providers, because all of us should really be equipped in being able to help a patient stop smoking and hopefully get those improved outcomes that we discussed previously. So let's talk about some other risk factors, and we'll focus on this slide on occupational exposures. The relationship between workplace exposure to various chemicals and an increased risk of bladder cancer was first noted over a century ago. And such exposures are thought to account for about 10 to 20% of bladder cancers. Occupations that have been linked to an increased risk of bladder cancer are listed here and include painters, hairdressers, because of increased exposure to hair dyes that contain carcinogens that are known to potentially lead to the development of bladder cancer, metal workers, rubber industry workers, leather workers, textile and electrical workers, miners, cement workers, firefighters, and those who help in the manufacturing of carpets, paints, plastics, and other industrial chemicals. So these are something that we should think about when we're taking a history, at least from a provider's perspective, and certainly as a patient or a patient advocate, we should be perhaps eliciting that information from folks who are potentially affected with bladder cancer. So how about the water we drink? And this is, there's some interesting studies out there about this. So first off is arsenic. So there are several studies that establish a link between high concentrations of arsenic in drinking water and the development of bladder cancer. And this relationship has been particularly defined in areas of Chile and Taiwan, where subsequent removal of arsenic from water sources led to a significant decline in the incidence of bladder cancer. Moreover, in high arsenic areas, there is data to suggest that patients from these parts of the world develop bladder cancer that tends to be more aggressive at the time of presentation. So something to think about. Chlorination is another potential link to bladder cancer. So chlorination is one of the most common processes by which drinking water is decontaminated for use by the general population. And some of the byproducts of this process can be harmful if ingested at high concentrations. And the government has actually set limits on the maximal permissible levels of these chlorinated byproducts in drinking water. There have been several studies that have been published that have investigated a possible relationship between chlorinated drinking water and bladder cancer, and there indeed may be an association with long-term consumption of such water. So while this information may convince you to stop drinking altogether, there are other reports that show increasing one's total fluid intake can actually reduce one's risk of developing bladder cancer. And this sort of makes sense because, again, by doing that, by consuming more fluids, you're actually diluting the concentration of carcinogens in the urinary tract, and perhaps that would lead to less interaction with the urothelium and possible, mutations that would lead to tumor development. So, I mean, personally, in my opinion, I think that the beneficial effects of water and fluid consumption likely outweigh any potential adverse effects from the decontamination process. So my suggestion is to continue to drinking water and perhaps use a water filter when you can. So. Okay, aristolochic acid is a compound that's found in some Chinese herbs derived from a plant known as the birthwort plant. And it's been used in Eastern medicine for various medical indications, including to induce labor during childbirth, to prevent infections after childbirth, to treat infectious ulcers and wounds, and even to treat asthma and bronchitis. Consumption of these Chinese herbs that contain aristolochic acid or prescription of this compound has been associated with an increased incidence of urothelial malignancies of the bladder, of the ureter, of the renal pelvis, otherwise known as the upper urinary tract, as well as been associated with liver cancer and even kidney failure. So it is something when you're considering taking herbal supplements, you got to be careful that there isn't anything in there that perhaps could be related to this particular compound. Chronic inflammation of the bladder, which is also known as cystitis, can also be a risk factor for the development of bladder cancer. Causes of cystitis that are known to be risk factors include inflammation that we often see in patients with recurrent urinary tract infections, some patients who have prolonged urinary catheters, for example, patients who have spinal cord injuries that aren't able to empty their bladder in a normal fashion otherwise, patients who have bladder stones that can cause inflammation, etc. So that is something that certainly puts these folks at risk. And again, as providers, we have to have a heightened suspicion for considering, an occult malignancy in folks who may have chronic cystitis. I did want to mention that there is a condition known as interstitial cystitis, which is associated with chronic bladder pain in the absence of an identifiable etiology. And this term is a bit of a misnomer because there's no clear evidence that bladder inflammation is involved in the etiology of this condition, nor is there any evidence that the condition is associated with any abnormalities of the bladder itself. And it's often thought that there may be some sort of systemic neurologic or inflammatory condition that leads to this diagnosis of interstitial cystitis. So as such, there's really no known association between interstitial cystitis and the subsequent development of bladder cancer. How about other miscellaneous risk factors? A previous history of having an upper urinary tract cancer, for example, within the ureter or the renal pelvis, would put patients at risk for subsequently developing bladder cancer. Patients who have had a previous bladder augmentation surgery. So, for example, if a child is born with a congenitally small bladder due to another condition, there are surgeries that we do that we could use a piece of intestine to make the bladder bigger, but that does have a risk down the road of the potential developing bladder cancer. And radiation therapy for that is used for another pelvic malignancy. For example, somebody's had a previous history of cervical cancer and got radiation as part of their treatment, or they had prostate cancer and they got radiation for treatment. Those individuals have a slightly increased risk of developing bladder cancer down the road compared to people that have never seen radiation. So again, this is important for us as a community to think about and have a heightened suspicion when we see someone who has, for example, blood in the urine and has had a history of some of these medical conditions. Okay, so certain medications can also increase the risk of developing bladder cancer. Patients treated with cyclophosphamide, which is a chemotherapeutic agent that's often used for lymphoma, have up to a 9-fold increase in the risk of developing bladder cancer. And the reason for that is because the cyclophosphamide gets metabolized to this compound known as acrolein, and that has a very inflammatory effect to the bladder. Often it will cause blood in the urine while patients are getting treatment with this particular agent. But down the road, they can develop potential bladder cancer. And there is a uroprotectant medicine known as Mesna, M-E-S-N-A, that inactivates this compound and can lower the subsequent risk of developing bleeding as well as that risk of developing bladder cancer when used in conjunction with cyclophosphamide. So medical oncologists who use this drug currently know to use Mesna along with it. It is standard of care. Phenacetin is an older painkiller that's no longer in use, but is a recognized carcinogen, and it was related to bladder cancer. More recently, though, are these oral hypoglycemic medications used for patients with type 2 diabetes known as thiazolidinediones. And in 2011, there was a report that found a link between pioglitazone, which is manufactured under the brand name Actos, and the subsequent development of bladder cancer. This association was initially described. It led to an announcement by the US FDA that pioglitazone use for more than a year may be associated with an increased risk of bladder cancer. And since then, the label for this drug was updated with this warning about this risk. Interestingly, though, in 2017, a meta-analysis of different diabetes drugs, including pioglitazone, was performed and found no difference in the rates of bladder cancer that was initially attributed to this medication. So the data is certainly controversial, but I do think that in patients who are diabetic, you may want to have a discussion with your healthcare provider about this medication, especially if you otherwise have risk of having bladder cancer, if you're a cigarette smoker, et cetera, and ask if there's another diabetic medication that perhaps you could take that would give you the same benefits for your diabetes, but perhaps not give you that increased risk of developing bladder cancer. Okay, a number of other factors have been postulated as risk factors for bladder cancer, but ultimately have found not to be associated with an increased risk. So these include air pollution, and a webinar on environmental risk is currently being scheduled, it looks like, and artificial sweeteners is something that we've talked about, and there have been studies done in rats that looked at supraphysiologic concentrations of saccharin and the subsequent development of cancers, but frankly, the concentrations that were given are much higher than anything that we would ever consume in our normal diet. Coffee and tea and personal use of hair dyes also have not been actually associated with increased risk. So these are all things that, again, you should probably be safe with.